Hello, everyone. First of all, I'd like to thank Dr. Salty and Regina Chortley for inviting the social work department to be able to present today. And second of all, I'd like to, we're very rarely in the same room, so I'd like to introduce the psychosocial team for Edward Cancer Center. And if you'll just wave, we have Aaron Polsky, Sharon Keller, and Deb Hartman. Usually we're at two different facilities, and sometimes we'll do like split shifts, and because we do night groups, and sometimes we do weekend things as well, and I'll go more into that as we go along. I'd also just like to say that as you can see, we have 4 clinical social workers at Edward Cancer Center. That is very rare, and that sounds like a lot of social workers, but what I would like to say is that that really says a lot about the organization, that not only do we want to provide the best medical care that we can for our patients, but we also take a holistic approach, and we look at the entire family, the children that are involved, the spouses that are involved, and the psychosocial issues that arise from a diagnosis of cancer. So we also have 7 to 8 nurse practitioners. 2 of those are navigators. Jill Wozni is the breast care coordinator navigator, and we have another navigator, Samantha, for all the other diagnosis. We also have oncology dietitian that is very valuable to all of our patients, and she also does some support groups as well that I'll talk about a little bit later. We have the palliative care nurse practitioner that is very valuable to our patients, and also we have the clinical trial department. So we have a lot of people helping in a lot of different areas. Okay, the mission of the psychosocial program is one of the things I'm going to talk about, also the overview of the program, the support groups, financial assistance, resources, referrals, and counseling that we provide. Also, I'm going to go over some of the distress factors that affect the patients and families, and how we can help in some of those areas. Okay, as you can see, the mission statement of the Edward Cancer Center Psychosocial Program is to provide a holistic approach, wellness program for the patients, families, friends, and members of the community. We focus on patient advocacy, emotional, educational, financial, and social support. And our goal is basically to nurture our patients, support our patients, and throughout the whole treatment, and that can be for many, many, many years. I'm still seeing patients that have been with us 10 years, 15 years. They come back to visit, they're back in their life, and they're doing wonderful. And also to help them maintain hope while they're going through the treatment and beyond. Okay, we have 4 full-time social workers. What we like to do is we like to be very visible to our patients and to our families. And what that means is that we're available when they come here on treatment. Many times they're with us for hours and hours, and for months and for years. So that way we can come to them. We go to them while they're on their chemo. We see them before and after during radiation. We can see them one-on-one, make appointments. We also counsel a lot in between the treatments. They're calling us all the time, and we can really help and not have them make a special trip to come and see us. So we do a lot of telephone counseling and provide a lot of resources when we're not face-to-face as well. We also meet them in support groups, and we have a lot of educational programs, camps, and we have retreats. So you're seeing some of the pictures, and some of these pictures are from our retreats that we have. But some of the support groups that we offer is a cancer support group, caregiver support group. That is also for post-surgical patients. Look Good, Feel Better has to do with hair loss and skin care and things like that. So we also have 24 of those a year, one in each facility every month, and it really helps. We have breast cancer support programs and support groups, and Jill Wozni is our breast care coordinator. She's actually doing a survivor seminar tonight for our cancer patients, and she runs the breast cancer support group. Camp Hope is very, very special. This is in the bottom part where we have the kids doing yoga, but also in our picture before. We have had Camp Hope for 11 years. And what this has to do with is it's for a week in June and a week in August, and we have 40 children whose parents or grandparents or loved one has been diagnosed with cancer. It is fully funded. We have, for all of our programs, everything is free, and you don't have to be a patient at our Edward Cancer Center. It's fully funded because we have people in the community. We have a Hoops for Healing tournament where 8 high schools do a tournament for us, local high schools. They raise a lot of money for us, and it's basketball tournament, high school guys. So that brings in quite a bit of money. We have the Phil Lawler Foundation, who Phil Lawler was an educator in the community, and his children and spouse set up a foundation to help the psychosocial programs and things that we need at the Cancer Center. They do that by golf outings, we do presentations, you know, whatever it takes. We also, for the 3rd year, we've gotten a grant from Bears Cares. And that also helps us with all of our programs and Camp Hope to fund it. Immerman Angels is just one where someone can be at home. We partner with them, and they'll do a peer-to-peer. So not everyone wants to come to a support group. That's not for everyone. Faces of Hope, that's a vision that we had to have professional volunteers within our cancer center. These are mainly, they're either caregivers of patients or they are survivors, and they get extra training. They do meet one-on-one with our patients. They do a lot of different things and provide just a lot of hope for our patients. They also bring them, we have a culinary program in our cancer center where lunch is provided, and the volunteers go and get that and bring that to the patients. So we also use Wellness House and Living Well. We do not have all the support groups because we are actually the treatment facility, and we're doing a lot of other things during the day. Our groups are in the evening or on the weekends. So Wellness House is in Hinsdale. It's about 27 to 28 years old, and it is just a phenomenal place. Everything is free, and people can go there, and it's for patients, caregivers, families. They have so many different support groups. I cannot even mention all of them. It's a whole brochure. Living Well is the same thing. It's in Geneva. So we feel that within our catchment area, we're getting a lot of help for a lot of our patients because we have Geneva, we have support groups where we're at, and then we have them in Wellness House. And then we also use outside resources. Dietitian support groups. Doreen has done an excellent job. She has done the Cancer Fighting Cuisine, different series, and that's education, cooking, reading the labels, knowing what to eat, and things like that. She's also doing a very successful Why Wait program, and she's on her second 10-week program. And that's for breast cancer patients who, through the hormonal therapies or just the treatment itself, where they've gained weight. And so this is a 10-week program, and it's just such a wonderful addition. Some of our complementary support groups, I feel these are so important. The talking groups and the networking groups are very important, but these are so very well attended. And what these have to do with is trying to help with the stress, the depression, the panic, the isolation that patients and families can feel, and also to get support. We've had mindful yoga now. It was one of the first groups started. It's been about 14 and a half years. It is so strong. We have anywhere from 14 to 22 patients and caregivers come every Thursday. It's very inclusive. There's always new people. We have all our own equipment. We have our own instructor. There's a picture right there. Very supportive. Healing sound, we're really big on meditation. We do a lot more than just a couple meditations each month. We have series of meditation because there's a lot of research to back that up. Back on Track is something that's really great. We're also big on exercise too, when it's appropriate. Back on Track is through the Edward Fitness Center. It's a special program for us. It is a personal trainer and small group. It has to be approved by the doctor that you can participate. It's 8-week sessions, and then it just keeps going all year long. We also have, if that has a little bit of financial piece to it, because it is at the fitness center and it does have personal trainer involved. But we have scholarship money involved by things that we do. So no one should not be able to attend any of this. We have scholarship funds. Wig Boutique. Wig Boutique is at the Plainfield Edward Cancer Center, and that's staffed by professional American Cancer Society volunteers. We partner with them on Look Good, Feel Better and the Wig Boutique. That is where you can get your free wig and professional consultation for that. So that's for all of our patients and anyone that needs that that goes somewhere else as well. We've also had many special programs: Tai Chi, aromatherapy, drumming circle, journaling, therapeutic arts and craft, massage, Reiki, craniosacral. We constantly, November, we'll get together again and we'll work on all our specialty programs that we're going to have the next year. Financial assistance. Okay, this is about a third of our job. It's very huge, and it is extremely important. Okay, this has to do with actually the livelihood of our patients and of their families, making sure that their employment is safe, making sure that their finances are safe. With the diagnosis of cancer, it affects every aspect of their life. So what we do as social workers, we keep track of all the paperwork, and we're very much involved in their employment, their cancer policies, their long-term policies, family medical leave, short-term disability, long-term disability. We also were nonprofit hospital, so an organization, so we have something called Edward Financial Assistance. So that is also offered. Co-pay assistance and patient assistant programs, this is huge, and it mainly has to do with the oral chemotherapies. Oral chemotherapies are extremely expensive. Even if you have great insurance, sometimes you're in the donut hole. Sometimes if you have private insurance, there's very large co-pays. Oral chemo can be as much as $10,000 in a month. Okay, you might have something like, yeah, your insurance pays a lot, but what if you had to pay $2,500 a month ongoing for your oral chemo? So this is where we work with all the foundations and we work with all the patient assistant programs to try to get help for our patients for those. We have a group called Chamberlain Edmonds now. We've contracted with them for 2 years, and this has coincide with the Affordable Health Care Act because things got really complicated. The marketplace, the Affordable Health Care Act, the expansion of Medicaid. So what we did is social workers, we used to do all this as well as doing the Social Security disability, forms. Well, now we contract with them, but we do the referrals with them and work hand in hand. Referral resources that we do, you can see on here, these are just some typical social work things that we do as far as all these resources and referrals. Counseling, we also make sure that we try to get if a psychiatrist, therapists are needed, and any additional groups for our patients. Psychosocial aspects of cancer. We know that distress is normal. We know that it is not abnormal to go through distress. These are common feelings. These are what we counsel are, just to know that you're not going crazy, that what you're feeling is normal actually helps the patient. We work to help them with these feelings, get them the help through medication, but also through our programs. We have something called a patient health questionnaire, and this measures the amount of distress a patient is having throughout the treatment. Our nurses give this out to the patients as they're triaging during certain times. This triggers us. We can see if it's going up, high, and what changes are taking place. This is where we meet with the patients and get them the appropriate help they need and just monitor that better. Some psychosocial effects of cancer, okay? As you can see, it affects everyone differently. It depends on the type of cancer, degree of disability, your intensity of treatment, your age, your past experience with cancer, your emotional makeup, the degree of support that you have, and how you deal with stress on a day-to-day basis and throughout your life. This is for patient and family. We know that they experience shock, disbelief, anger, guilt, deep concern for family members. They're really trying to grasp, get a hold on their feelings and things like that. And these can all go back and forth, and we try to work with the patients on all these different things. Okay, here's changes on treatment and lifestyle. We know surgery, hospitalizations, the recuperating from surgery, medical visits for chemoradiation, managing side effects from all these things. Also a disruption to employment, activities, travel, transportation is a big one, finances is huge. Also, roles change. We also know that our families are also, they're doing something called anticipatory grief. They have losses. You might have loss from surgery. You might have losses that you're not able to do the things you were before or have the energy, or that sometimes your children are taking on more of a role in the family and somewhat parenting you while you're going through the treatment and that. So these are all things that we work with. Caregivers. We worry a lot about the caregivers, okay? So we know the longer that it goes on, the more we worry about the caregivers. One of the first things we asked is when we see the caregivers, when was the last time that you saw your doctor? Are you keeping up with your regular medical appointments, things like that? Because many times that is put on the wayside and they're just caring for their loved one and they're under so much stress. A lot of times they have so many more responsibilities, financial responsibilities. So we meet a lot with the caregivers. These are all things that the caregivers experience, and we just try to be there for them in certain ways and plug in certain resources. Okay, we know that cancer is a family disease. It affects every family member. So it's a personal experience. We try to be there in different ways. So we try to have all these different ways that we look at it. If we can't help in one way, we try to help them in another way or multiple ways. So that's it, and that's our website with all of our support groups and things like that. So thank you very much.